Thanks for allowing me to serve. This room is full of servant leaders. We all share a love of the profession and a respect for our colleagues. I'm counting on all of you to help us make a change for the better as healthcare reform evolves. And speaking of respect, let me thank Sue Bailey, a mentor and friend, a national class medical leader and communicator. That's what's so daunting about following her in this office. Next month, we hope to convince the American Medical Association to elect her Vice Speaker of the House of Delegates. She led with a promise to help us survive and thrive in the new healthcare landscape. We must continue even further down that path because we are just now getting the rules and details of what that job will be. I want to thank my Travis County delegation sitting down here in the front, and special thanks to my first mentor, Ruth Bain, Joe Annis, Earl Grant, and my friend David Flieger. Belinda Clare and Marshall Cothran have been with me through every campaign and are friends as well as capable leaders of the staff at Travis County. About 44 years ago, I met a beautiful, intelligent woman with a great heart at Duke, and I was smart enough to marry her. So I want to introduce Libby, and I want to assure you that this is one of the few venues when I wouldn't be introduced as Libby's husband. I also want to thank special friends, Drs. Linda and Dr. Jim Prentice, who came all the way down to Houston, and they're sitting in the back. Now, my family is scattered all over the world. But last night at 1 o'clock in the morning, there's a knock on my door, and my daughter Katie from LA showed up unexpectedly. So I have a picture of my family at Katie's wedding last October, and I wanted to share it with you. My daughter Ellen is on the left, my granddaughter Annabelle and James Hourigan, Katie and Nick, and one happy grandmother on the right with Lottie, my grandchild. Now, my granddaughters are Aussies, and they're going to think I talk funny. So where are we? We're working in a system that costs too much. Business is worried that medical costs are going to make U.S. goods non-competitive. We have an employer-based health insurance, and other countries have personal taxes to fund their system. Our per capita spending for medical care is at least 2 and sometimes 3 times what it is in other developed countries. We have amazing technology and skills. If you're sick and you have a special need, you usually come to the United States from anywhere in the world to get that need taken care of. But overall, our U.S. health is not all that great. We have problems of obesity, diabetes, heart disease, violence, and the big specter of the uninsured. We cannot just pretend these facts away. In this time of disruptive change, we cannot just say, no, we want things just as they've always been, because change is happening all around us. If we don't think we can accept radical change, we are really not going to like being irrelevant. So where are we going? The new Affordable Care Act has confused doctors and confused patients. We have factions challenging the mandate for health insurance, and I understand the reasons. But no universal coverage without some sort of mandate can occur. Our AMA policy is that we have individual ownership that is portable. No commercial market can survive without the mandate if the incredibly popular guaranteed issue is part of that reform. So, we may litigate our way into a single-payer system as probably the only viable option, and that certainly is not what I want, and I don't think it's what you want. Already, the U.S. government pays for 40% of all health care. TMA has said all along we want to keep what is good, get rid of what is bad, and add what is needed to the Affordable Care Act, and we've even written it down. In this time of disruptive change, we cannot just say no. We have to help reorganize the medical marketplace so that it creates more value for those who pay for it. We have to help reorganize the medical marketplace so it gives us the right to practice in an ever-expanding public system with the option to contract privately with patients who want more. The good news is that we spend such a large amount of money on healthcare in this country that if the doctors who know how to treat are allowed to organize, we can cover everyone for basic services, and we can cover advanced care for those who want it. Dr. Tom Price's bill on private contracting, I think, is the start of a terribly important legislative battle for American medicine. Another new trend is doctor employment. TMA wants to be relevant to all doctors in Texas, no matter how they are paid. We are not giving up on our prohibition of the corporate practice of medicine. We know that doctors need to be protected from some corporate methods, but like any innovation in medicine, organization of new care is crucial. So we introduced novel legislation to support and protect employed physicians. To satisfy the value proposition, we have to recognize the medical marketplace so it delivers the right care at the right place, at the right time, and at the best price. Good medical care will never be cheap. Prevention can be. So in 2014, we're going to face more regulation with the Independent Payment Advisory Board. We're going to see major changes in Medicare, Medicaid, no matter what your party. We have Obama's proposed $500 billion cut in Medicare, and we all know where that's coming from. We have Congressman Ryan's vouchers that shift costs to the individual and do not do anything, in fact, utilize the SGR cuts to balance the budget. My friends in the insurance business tell me that limited panels on commercial insurance based on cost effectiveness are coming now. They have told us the urgency that we need to have to respond to those. And we all know that the way they create the data is not fair. So we can't just say no to these changes. We have to offer a better way for our patients, to the government, to private insurers, and to employers. We have to reorganize the medical marketplace. Private contracting to give us the ability to work within the public system, no matter how misdirected. More patient choice. You know, we're sometimes actively involved in the legislative process, but we have an opinion on everything. The best results I've seen in my memory with the Texas Medical Association were in 2003 during our tort reform battle. And that's because we were focused. So we just can't say no. As physicians, we must defend our autonomy or risk being dumbed down. We must create new forms of practice while making care in our offices and in the hospitals more safe. Finally, if we work with our patients in mind, they will support private contracting because they will have more choice and we will have more autonomy. And the ability to continue to innovate and advance technology and practice. And that's the big danger I see that we stand to lose if we become a bureaucracy. We are so fortunate to have our life's work be meaningful and valuable. Valuable to society because we increase population productivity. Every day I decrease pain and restore function. And it's a wonderful way to have your day. So we have the distinct privilege of being part of our patients' lives. So let's roll up our sleeves and meet the challenges. Let's stop saying no to the changes all around us, some of it very necessary. And let's be leaders in reorganizing the medical marketplace. When we meet these challenges, just as our predecessors have done with science and innovation, we will be helping create a unique American system of care that works for us and works for our patients. I hope you all will help, and I'm going to work as hard as I can. Thank you.